Good evening, ladies and gentlemen, and welcome to KNDI ATRI Live Broadcast channel. So today we're going to begin with a simple question. When we talk about a strong health system, what comes to your mind? Is it hospitals? Is it doctors? Is it medicine? All these are important, but we normally forget a very critical aspect, which is nutrition. You cannot have a strong health system without good nutrition. So today we are delighted to host a very special guest who is going to talk about the role of clinical nutrition in health system strengthening. So welcome, Prof. You can proceed to introduce yourself.
Thank you very much, Laura. As you mentioned, my name is Professor Nguka Gordon. I'm a professor of clinical nutrition and dietetics, based at Masinde Muliro University of Science and Technology, Department of Nutritional Sciences, School of Public Health, Biomedical Sciences and Technology,
Yes.
and a member of the Council. As you've indicated very clearly, nutrition has always been forgotten. Yet, nutrition is actually the base of clinical care. It's actually the foundation of healthcare, because the body, the same body that we treat, is actually made of nutrients.
Yes.
It's actually a combination of nutrients. So without nutrition, you cannot purport to be strengthening any health systems, ranging from human resource for health, the medical health products for treatment, and all other aspects of health system strengthening,
Yes.
including technology. All these are a component that will only work when nutrition is taken into consideration, both as an interventional setup and also in the human resource for health.
Yes.
Yes.
So thank you, Prof, so much. So now when someone says nutrition, clinical nutrition strengthens health system, what do they mean?
What they mean is that without clinical nutrition, then there is generally no health,
Yes.
because all other products that have been used in the hospital, call them medicines, they are not actually helping in building the body. They are helping in curtailing the conditions that brought the deterioration of the body.
Yes.
The nutrients is the one that repairs the body after it has gone through diseases.
Yes.
Giving examples, most of the products that we use as medicine in the clinical area, over 50% of them are actually nutrients. And I can give you what people think are drugs, but are actually nutrient supplements. Neurobine being one of them, which is used in the management of nerve problems, like peripheral neuropathy. Neurobine is a combination of vitamin B1, B6, and B12 in hydrochloric acid.
Yes.
It is being prescribed as medication, yet it is just a supplement of nutrients, which could actually be used, taken in the hospital. Above that, you will also find that this, for example, anemia.
Yes.
In anemia treatment, you just need nutrient supplements, like iron and folic acid, to be able to manage, in addition to vitamin B6 and even vitamin B12, especially for megaloblastic anemia. So you realize that all those are nutrients.
Yes.
Just to mention a few. Beyond that, you can also be able to see that drugs interact with the nutrients, and they also interact with foods. The foods that we eat interact with the drugs. And even nutrients also interact with the drugs. And I can bring a section in play in the management of heart conditions,
Yes.
like the weakening heart functionality. You'll need treatment like digoxin.
Yes.
Digoxin is depotentiated by all products that have phytates, and especially the wheat products. So in an ideal situation, when digoxin is prescribed, then you need to remove in the food systems of that fella all products that are contained of wheat,
Yes.
because they are affecting the functionality of digoxin. In a similar manner, some nutrients and even foods actually complement some drugs. A case which I can bring on board is a situation where you're managing sickle cell anemia,
Yes.
or any thrombus for that matter. When there is a thrombosis, the prescription that medical doctors will do is to get an anticoagulant. And most of the anticoagulants, for example, aspirin, acetylsalicylic acid, or heparin, some foods have been known to have compounds similar to that, like garlic, like onions, like tomatoes. So in such a situation, once a prescription has been made, for example, of heparin or ASA, acetylsalicylic acid, or aspirin, or anybody suffering from thrombus or from clots, like the children who are suffering from sickle cell are very prone to clot. Once that drug has been prescribed, then you need to now add those foods that are rich in garlic, rich in onions, and rich in tomatoes, so that they can complement the work of that. Now, this is not known by everyone. It's the nutritionists that are able to do that. You can see how that is going to help in complementing the management of that condition. I've just mentioned a few, but I can assure you, in the hospital setting, even in conditions that are causing us problems like heart naps, heart naps are actually managed using niacin. You don't even need anything else. You need a niacin, which is vitamin B3, and you'll be able to manage that problem. Seborrheic dermatitis is managed using biotin. Yes. That scaly, flaky skin dermatitis, biotin will be able to manage it. And it is the drug that is actually being used. So you can see the basis, the foundation of health. And if you want to say that you are providing health system strengthening, the nutrition must be a component, not just a component, but actually the base of it all. Yeah. I've just mentioned a few, but I can assure you there are many, including malaria. Yes, what I'm saying in the overall terms is that there is no management of health systems without nutrition. And that everything in the hospital care is nutrition first, followed by other things.
Okay, thank you, Prof, for that. So, because anytime we talk about nutrition, people normally talk about, they think it's all about food and diet. So now, just in summary, why do you think it's integral for us to integrate clinical nutrition into health system strengthening? Why is it important, given the examples you've given us?
At least you have just seen even what I've said. It's not just food and diet. It's food, nutrients, and diet. And it is affecting even the management itself. And even what we talk about as medicine are actually nutrients. So integrating nutrition in the overall healthcare systems, the entire spectrum, simply means giving the credence or enhancing health of the individuals that you're managing. It helps in reducing cost of hospital stay. It enhances recovery. It reduces, the relapses, potential, even in TB, for example. And this is known, that TB, you cannot treat TB without including vitamin B6. Because the drugs that are used in management of TB, like rifampicin, isoniazid, streptomycin, are actually increasing the excretion of vitamin B6. And you seeing that even in TB clinic, a nutrition is supposed to be there? And without a nutritionist that is actually discerning this properly, then there is no management of TB. That's the truth. Because the impact of the drug sometimes are too serious. Most of the TB patients will suffer from something called neuropathy, which is as a result of the excretion of that vitamin B6. So it has to be supplemented. This has been known. And that goes with every single disease in the hospital, including malaria. Including malaria and all other infections. Yes. All they need to do is to know which kind of food goes with what kind of nutrient, what is supposed to be contraindicated, what is supposed to be included. And that work is left for clinical nutritionists and dietitians.
So now, given your vast experience in the clinical setup, what are some of the challenges and gaps that you've experienced when trying to integrate clinical nutrition into the health system?
Thank you very much, Laura. There are a number of challenges. One of the biggest challenges that we have as that we talk is the human resource for health. There are too few nutritionists and dietitians in our health systems compared to the numbers and the service they are required to give. Ideally, every ward in this country
Yes.
should have a nutritionist to be able to deal with this either strategically. But that is not happening. So number one is the limited human resource for health in the area of clinical nutrition, and even in addition to their specialization, we need some nutritionists to specialize in those specific areas.
Okay.
Number two is the health products. Nutrition and nutrient products, some of them are not even procured properly
Yes.
for the purposes of management of conditions. They are seen as secondary. But sometimes they are needed, and the doctors don't understand that these things, without them, even the medicine does not work.
Yeah.
So the purchase and the procurement of nutrient and food products or food supplements are not even done properly. So that's another gap. The third gap, which we see is critical, is that the food and nutrition intervention, or what I call nutrient and food interventions in the hospital, are not even catered for in the SHA. So that's another gap, hence making it very costly to do nutrition intervention for patients.
Yes.
So my advice to the ministry is that include the nutrient and food products in SHA as costable to reduce its cost from patients, and that will enhance management. And very many other things that I can be able to include as gaps, but I've mentioned those three that need to be attended to very urgently.
Yeah. So thank you so much. So now we have normal Kenyans, normal Mwananchi watching this. Why should they care about clinical nutrition in health system strengthening? Why should they know?
Let's tell Kenyans that their body is made up of nutrients. Their entire body is made up of nutrients. So you should care about nutrition and nutrients because you are caring about your body. Caring about your nutrient and food means caring about your body. Without nutrition, there is no body. It's the nutrition that forms the whole body. And even when it comes to protection against diseases, what we call prevention of diseases, it is nutrition that forms that prevention bit. It's the nutrients that you have that gives the immunity to your body that will prevent you from catching up bacteria, viruses, and that will also help you in recovery, which means will reduce your hospital visit and therefore reducing your cost of healthcare. So that is why you should care about your nutrition.
Okay.
Yeah.
Thank you so much, Prof. We've come to the end of today's session. So to our viewers, thank you for joining us. Kindly tune in same day, same time, every Thursday at 6 p.m. Goodbye from your host, Wangara Laura. Remember to eat informed.